he actually found that there was a worsening, which is surprising. And then if you didn't use the sham, they found it was significantly better in terms of live births. It was confusing. And one of the speakers today, I think, will discuss why the use of sham, why the use of other points can confuse from a traditional Chinese medicine our understanding of its efficacy. So it's critical that when we're doing and designing studies, we don't take one type of medicine and assume that the way we think about how that medicine works is the same in another type of medicine. And this is the challenge in getting Western doctors to even have conversations with traditional Chinese medicine doctors, is that we think differently. Our view of the health of the individual is different. We as Western medicine docs look at very small points. Holistic or grand or total body medicine is what traditional Chinese medicine does. So it is a challenge to get us to speak the same language. And Zhang also asked a different question, and that was, where in the treatment of the patient does the effect happen? Is it before they're stimulated with the fertility medicines? Is it around the time in which the embryo was transferred, or is it around in terms of clinical pregnancies or in live birth? Are there differences? And we, in our literature, we never published it, but we did not find that simply doing the treatments during the transfer made an effect. It was a cumulative effect, and I think traditional Chinese medicine works over time. It's not a pill type therapy, and so this made sense. And if you did just the acupuncture during the egg retrieval portion, there was no effect. So we're beginning to dissect and understand not only the medicine, but how the medicine should be applied to the patient for the best efficacy. Because it's how we impact the patient that determines the value of our medicine. And this is just around controlled ovarian hyperstimulation. Again, not significant. So we're challenged. Mannheimer then came back and looked at his own research, which he had done almost 8 years prior, and then looked back at the newest literature, so in a sense, to publish again his own work. It was an interesting question. And what he found was that in clinical pregnancies, there were no differences, and now we're looking at 4,000 patients. His original study was about 1,500 patients. No effect with sham, and if you just don't do a sham acupuncture point, which you as acupuncturists know has an effect. It may not have an effect specifically for fertility, but it has an effect that there was an improved outcome. Live births, no effects, no effects. So now there's a conundrum because something that did seem to work is now being challenged as to whether it helps at all. And why does this happen? It's a statistical anomaly, or is it a statistical fact? There's a term called regression towards the mean. If you get a very random event and you keep doing it, it sort of comes out the way you expect, which is non-significance. That could be the reason. It could be the law of large numbers. In other words, as we see more and more patients, the ability to differentiate differences because of the variability with the patients makes it harder and harder to distinguish. So our studies have to be bigger and bigger, which in turn makes it harder to find a difference. I'm not here to challenge whether, it would be very insulting if I challenged whether acupuncture can help. I'm really trying to say is when we do the research for the patient's safety, it is critical that our data are accurate, that they represent as close to facts as we can for the efficacy of our medicine. And that's my challenge, is to do that for my own research, but I challenge you to do it for yours. And as I said, in the term of the law of large numbers, Mannheimer looked at 1,000 patients, everything was significant. When he redid his studies based on 4,000 patients, very few areas of significance were revealed. So just because you saw something and it was in the literature as significant, you may challenge yourself to say, are the studies large enough? So I want to just use as an example back pain, and I know you have many more experts here in back pain in this field, but what's interesting in the field of back pain is they've done meta-analyses. They've shown areas of significance and non-significance in terms of the studies that have been done. So even though it is now considered a standard of care in America to use acupuncture for pain, even in that area itself, you can see that there's some controversy as to whether it's efficacious or not. And this is the slide that I think is important as a summary for that particular group. And that is, what they found is that if you know that you are getting acupuncture, you are more likely to have a positive response. So the mere knowledge, we can call it a placebo effect. I don't believe it's a placebo effect, but the actual knowledge that you are getting a therapy that is supposed to work will change how that person responds. If you know there is no effect, in other words, if you believe that it can't help you, then that will influence how and why the result may be different. Now, in our Credenda Magarelli acupuncture protocol, we did not see that because our patients, it was so new, they had no idea, but we still saw an effect. If you look at the immediate effects, in other words, do you feel better or am I better now, you'll see an effect, but it may be over time you may not see that effect. If you look at the effects after 3 months, this is just describing these various studies, why they were not statistically significant. They found no benefit. High-quality acupuncture has beneficial effects. There is a study done in which nurses are trained just to put the needles in. This was for fertility, and they found no difference in the patients treated with just putting the needle in versus a trained acupuncturist who understands the whole field of medicine. It tells us that this is not just a technique. It tells us there's more to it. Protocols do not have an effect. This is their assumption, and yet, in our literature that Dr. Credenda and I published, protocols allowed us to get our Western brethren to use our medicine, and today, every single IVF center in the United States uses acupuncture directly or indirectly based on the fact that we've been able to demonstrate its efficacy as well as the patient desire. Here they're saying that needles only have no effect. Needles plus electrostim does. In our protocol, we did do electrostim. And the number of sessions are important, and that's what we also found. I'd just like to close the discussion with the next phase of reproductive medicine research with traditional Chinese medicine. And the description that's used now is called whole systems. In other words, we are no longer simply looking at a protocol. We're looking at the difference between no treatment, treating with a protocol, and then treating the whole body. And I think this Congress is about treating the whole body. And I think traditional Chinese medicine is about treating the whole body, and is there an effect? Now, this happens not to be a very good study, but it's the only study that's available today. And what they did was evaluate whether or not whole systems traditional Chinese medicine would be better than simply embryo transfer protocol, the most widely studied protocol. I'm sorry. What they found, and unfortunately the data from a reproductive medicine standpoint are suspect, was that in their design, the groups that did not receive acupuncture had fewer embryos transferred. They said due to statistical anomaly, and the statisticians said that doesn't matter. But you and I know that there's a practical aspect to medicine in which your experience teaches you something. If you put in twice as many embryos, you would expect a better outcome, and they use statistics to say that's not true. So your practical experience has to sometimes trump a statistical test. This is just demonstrating that there are many studies that do say the number of embryos matter, and they do, of course, and that difference is almost about 13%. which you can see down here. So if you put one embryo in, there's a 29% pregnancy rate. If you put 2 embryos in, there's a 44. Another study looked at level 1 data. The number of eggs retrieved and the number of embryos put in were critical. In this study, they did find a 10 to 13% difference when whole systems acupuncture was used. But I challenge, and that is, if you add 1 more embryo, then you have an 11% chance, improved chance of a positive outcome. And if you use whole system and 1 embryo, you have a 10 to 13%. In my mind, the logic of that says it is likely that it was the number of embryos and not whole systems. I'm not here to criticize whole systems, but I'm here to challenge you that when you're designing your experiments and doing your protocols and desire to demonstrate safety and efficacy in this field of medicine, ensure that you look at both sides of the equation, your hopes and dreams for it to help, and the realities that science will give you. The other challenge I have in this field is for specialty trained acupuncturists in the field of fertility to look outside of the box. Everyone focuses on in vitro fertilization because in America it's not covered by insurance, so any way we can help our patients in a cost-effective fashion to achieve a pregnancy is critical. But what about endometriosis, a chronic pain problem? What about polycystic ovarian syndrome, an issue related to ovulation? What about pelvic pain, which can be debilitating? What about the obstetrics area? What I challenge my colleagues in America, and I hope you envision this as just a helpful suggestion, is, and you may be doing this because I don't know, it is important that in the area of reproductive medicine that we go not only with fertility, but think about the whole woman, the whole system. Because I believe that traditional Chinese medicine, when combined with Western medicine, will certainly help in a very broad fashion. Thank you.
Thank you, Paul. That was indeed stimulating and intriguing, a wealth of information. We have time for a few questions, perhaps a couple.
Thank you very much, Dr. Paul. Very informative lecture. Just wanted to ask, because what I learned from the lecture was that acupuncture needles worked on the stress hormones, basically, which triggered the conception, which helped in that. How about if we could add some lifestyle changes, diet, and some brain calming herbs or supplements in conjunction with the acupuncture? Would that make a better difference?
Thank you very much for the question. The question is can adding the other modalities in the form of herbal therapies in conjunction with acupuncture, can that contribute to a positive outcome? That's your question, right? In America, because of our medical legal situation, it is challenging for us to accept adding a pharmaceutical, which is not a pharmaceutical, a nutraceutical or the form of an herbal therapy to our treatment of infertility patients because, number one, the patients pay out of their pocket. So if there were a additive effect, that would be wonderful, but if there was a negative effect on the other medications that we use, then we would be challenged by our medical legal system to say you created harm. So most of us in the United States don't allow our patients to add herbal therapies, but I'll give you a caveat. The American Board of Oriental Reproductive Medicine, which Dr. Credenda is going to talk about this afternoon, are trained in the board, they get board certified in working with Western doctors with their patients. In my practice, Dr. Credenda has complete the complete ability to choose whether she adds herbal medications. I do not believe they have a harmful effect, but I would say that most Western trained physicians are ignorant, and I don't say that in a negative way, they just don't know, and therefore they tell their patients absolutely not. And acupuncturists in the United States if the Western-trained physician finds out that their patients are on it, they will never allow referrals to that doctor. So it's a challenge, but I do think when you see the data this afternoon with Dr. Credenda, there are many ways which herbal calming medications may help, but I challenge you this afternoon to ask that same question after she presents her data, because I think you'll be very surprised at the role acupuncture plays in these hormones. And I don't want to take her thunder, but ask that question this afternoon.
Thank you so much. Thank you.
We have another question from Dr. Khoja here, please, in front. Go ahead.
Thank you so much. I really enjoy your presentation, Dr. Paul, and I do appreciate your loyalty based on evidence. This is very important, and this is what we are waiting. Thank you so much. Just listening to the sample you have, I would like to know. You said that there is this maneuver it was good for patients or pregnant ladies, for patients or females who has difficulties in getting pregnancy.
Yes.
This is your statement.
Yes.
So I would like to know what are these difficulties. The second issue about the characteristics of this woman. Are they free from diseases? Do they have comorbidity or not? If they are on drugs or not, they are taking medicine or not. So because this is very important, the confounding factors. He asked one issue, the food and lifestyle. I am asking the other medical side, like if she's diabetic, if she's hypertensive, if she has, she's on